Hi, my name is Dr. Scott Williams. I've been practicing in Powell, Wyoming for about 12 years. Over the last 12 years, I've had the opportunity to take care of a lot of wonderful people. We've seen everywhere from just newborn all the way up to 99 and 100 years old in our practice. In doing so, we've been able to see a lot of the things that happen through a lifetime of good oral hygiene, and also what the result is when we don't start off in just the right ways. In addition to that, I'm also the father of 9 children. So I also have a lot of personal experience in how difficult sometimes it is just to try to take care of your own children. So what my goal today is to try to help you to understand why it's important to do things in the right order and at the right time. Some of the things that help us to understand this is when our children's teeth develop. Actually, one of the most interesting things about tooth development is that our children's baby teeth start to develop really early while the mother is pregnant. And even some of our permanent teeth are developing before the baby is even born. So what that means is our babies and our children's oral health really starts long before they're even born. When mom is taking good care of herself, we can be assured that also the baby is going to be taken well care of. So let's fast forward just a little bit of time, and as the baby begins to develop, usually they'll start to have teeth come in between 6 months and a year old. That is a very important time. As your baby's teeth start to develop, that's the time to start getting them in to see a dentist. Why would we want to see a baby so early in their life, 6 months old? There's lots of wonderful reasons for that. Number one, we are able to get them into the habit of seeing that there's a safe place to be and that the dentist doesn't have to be scary. Number two, we can help to begin to catch little things that could begin to be big deals later on in life, whether that's developmental or some of the things that happen with just habit and environment. So when it comes to parents and some of the things that you can do, we need to help our children very early on develop a good oral hygiene regimen. The habits that help to carry with them through their entire life so that they have healthy, strong teeth their entire lives. One of the first things that we learn is that teeth brushing is a very, very important part of that. That seems very obvious, but how, when, and all of the things that go into it. Do we use fluoride toothpaste? Do we not use fluoride toothpaste? Do we use these training toothpaste? There are so many parts of this. So just to break it down really easy, the best thing to remember is 2 and 2. If we can get our children into the habit of brushing twice a day for 2 minutes every time, that habit will help them to have strong teeth for the rest of their lives. Fluoride toothpaste. You know, there's a lot of great products out there on the market. And right now, the American Dental Association is recommending fluoride toothpaste as soon as teeth start developing. But how much is really important. For little children who are not capable of spitting out the excess toothpaste, a small smear on their toothbrush, less than the size of a grain of rice, is the perfect amount for them. That way, if they do swallow their toothpaste, they're not ingesting fluoride into their system that's in any kind of amount that would cause them any problems. As we get older and we start to get to the point where children can properly spit out the excess toothpaste, a pea-sized amount of toothpaste is just about perfect. A lot of times we see these commercials where you see the Aquafresh ribbon with the great big ribbon of toothpaste on the toothbrush. That is not necessary, nor is it good, because it gets to be too much for what needs to happen. So a grain of rice when they're too young to spit out the excess, and the size of a pea when they're just a little bit older. The fluoride becomes very important. Since back clear in the 1950s, we started realizing that just adding a little bit of fluoride to the daily regimen makes a huge difference in decreasing the amount of decay that we see. And so While there is a fair amount of fluoride in toothpaste, we don't ingest that, and so because we're expectorating or spitting all that extra out, it's a safe thing to do, and it helps to keep your teeth and your children's teeth very healthy. Now, let's go and add one more thing into that, and that's flossing. If you'll think about flossing for just a second, it's to get the debris or the food or other things out from between your teeth. If we floss before we brush, we can get that debris out of the teeth, and then the fluoride can get into those spaces where cavities really like to happen. If we don't floss, the food and the debris that we didn't get out and that the toothbrush can't really reach is blocking the fluoride from being able to go in and to remineralize the teeth. Now, there are a lot of other products out there, and I know that there are some people who are concerned about fluoride. Even with the other products that are out there that are geared towards helping to remineralize teeth, clearing out in between teeth becomes very, very, very important to be able to have those cavities and those small beginning decay to be able to be reversed or at least stopped, so that we don't get to a point where what we're doing becomes very, very expensive and sometimes even to the point where it becomes painful. There's some other things you can do too besides just oral hygiene. It's important that we're taking care of our teeth when we're eating and drinking. What do I mean by that? Well, there's a lot of drinks out there on the market that are very popular. Of course, there's soda pop, and it's pretty common to know that soda pop is not great for your teeth. But let's just talk about a few others. I wrote down a list of some of the common drinks that are being consumed by children and by youth. Apple juice. Apple juice has 33 grams of sugar. It also has a pH of 4. Now, why is that important? Before I go too far into this, let me just explain what happens in your mouth. Our mouth is made up of really, really, really important structures, and the teeth have the structure of enamel on the outside. That enamel begins to lose minerals when the pH of whatever you put in your mouth pulls things down to 5.5. Now, apple juice is at 4, which is 10 times or 15 times more acidic than where we start to lose the strength of our teeth. Then there's things like Propel water, which is 100 times more acidic or 100 times more likely to have us lose the minerals from our teeth. How about Red Bull? That's a popular one for the youth. That's 3.5. Again, 100 times beyond the point of where we start to lose minerals. So really likely to cause problems. Then I'll jump clear down here to the Rockstar. Rockstars are 1.5 on the pH scale. That is 1,000 times more likely to cause problems, and actually 10,000 times more likely to cause problems than regular tap water. It's horrible for our teeth. And then we add on top of that the 64 grams of sugar that are in a Rockstar. So what happens with all of this? Acid leaches takes the minerals right out of our teeth, and when we lose minerals, it gets weak. And then that weak spot will then develop into a hole, and then the bacteria that help to create make the cavity bigger get in that hole, and it just grows and grows and grows and grows until eventually the tooth starts to hurt us. So that's where I come in. It's really important that you see your dentist on a regular basis. If you can get to your dentist twice a year, that would be ideal. What we're able to do then is take a good look and examine your teeth to find the problems before they get to the point where they're going to cause cavities, abscesses, and really traumatic experiences for your little ones. Again, developing proper oral hygiene habits and also developing proper regimens at the dentist and helping them to feel comfortable here will lead to you being able to have a lot easier time helping to take care of your children and having a lifelong positive experience with their teeth. Thank you very much and have a great day.